Before we begin, if this is the first time you visit to our channel, you consider to subscribe. Trust Dr. Channel Dr. Abid El Wahed. What to know about constipation? Constipation occurs when a person has difficulty emptying the large bowel. Home remedies and lifestyle changes can often help resolve it, but sometimes, it may need medical attention. Constipation can happen for many reasons, such as when stool passes through the colon too slowly. The slower the food moves through the digestive tract, the more water the colon will absorb and the harder the feces will become. A person who poops fewer than 3 times per week may have constipation. Sometimes, constipation results from a blockage in the large intestine. In this case, a person will need urgent medical attention. At other times, it may simply be due to a lack of fiber or water. Symptoms: the main symptoms of constipation are difficulty passing stool, straining when passing stool, passing less stool than usual, lumpy, dry, or hard stool. Other symptoms include pain and cramping in the abdomen, feeling bloated, nausea, a loss of appetite. Complications: constipation on its own can be uncomfortable, but it typically is not life-threatening. However, it can become a problem if it is a symptom of a more serious underlying condition, such as colorectal cancer, or if it starts to cause further damage. Damage that can arise as a result of severe constipation includes rectal bleeding after straining, anal fissure, which is a small tear around the anus, symptomatic hemorrhoids, piles, which are swollen, inflamed blood vessels in the anus, fecal impaction, which occurs when dried stool stagnates and collects in the rectum and anus, potentially leading to a mechanical obstruction. Other possible complications include a reduced quality of life and depression. Seeking medical advice for constipation may help prevent complications. Causes: the following are some common causes of constipation. Lack of fiber in the diet. People with a high intake of dietary fiber are less likely to experience constipation. This is because fiber promotes regular bowel movements, especially when a person combines it with proper hydration. High fiber foods include fruits, vegetables, whole grains, nuts, lentils, chickpeas, and other legumes. Low fiber foods include high-fat foods, such as cheese, meat, and eggs. Highly processed foods, such as white bread. Fast foods, chips, and other pre-made foods. Learn more about foods that can prevent and treat constipation here. Physical inactivity. Low levels of physical activity may also lead to constipation. Some past studies have found that physically fit people, including marathon runners, are less likely to experience constipation than other people, although the exact reasons for this remain unclear. A study from 2013 notes that increasing mobility might help improve constipation among older adults. People who spend several days or weeks in bed or sitting in a chair may have a higher risk of constipation. Some medications can also increase the risk of constipation. These include opioid pain relief drugs. These include codeine, present with acetaminophen in Tylenol No. 3, oxycodone, OxyContin, and hydromorphone, Dilaudid. Tricyclic antidepressants. These include amitriptyline, Elavil, and imipramine, Tofranol. Certain anticonvulsants. Examples include phenytoin, Dilantin, and carbamazepine, Tegretol. Calcium channel blockers. These lower blood pressure, and certain types lower heart rate. They include diltiazem, cardizem, and nifedipine, Procardia. Antacids that contain aluminum. These include Amphigel and Basalgel. Antacids that contain calcium. One example is Tums. Diuretics. These remove excess fluid from the body. They include hydrochlorothiazide, hydrodiurol, and furosemide, Lasix. Iron supplements. Doctors prescribe these to treat iron deficiency anemia. Irritable bowel syndrome. People with functional intestinal difficulty, such as irritable bowel syndrome (IBS), have a higher risk of constipation than people without the condition. A person with IBS may experience abdominal pain, bloating, distension, changes in the frequency or consistency of stools, With IBS, constipation can fluctuate over time. When constipation is not present, there may instead be loose stools with diarrhea. Aging. As people age, the prevalence of constipation tends to increase. Up to 40% of older people in the community and up to 60% of those in institutions may experience constipation. The exact cause of this remains unclear. It may be that as people age, food takes longer to pass through the digestive tract. Many people also become less mobile, which may also contribute to constipation. Medical conditions, medications, and a low intake of fiber or water may be other factors that lead to constipation with age. Changes in routine. When a person travels, for example, their usual routine changes. This can affect the digestive system. In an article from 2008, scientists asked 83 people about the digestive changes they experienced while traveling outside of the United States. The results showed that 9% of people experienced constipation when they went to another country. Eating meals, going to bed, and using the bathroom at different times than usual could increase the risk of constipation. Overuse of laxatives. Some people worry that they do not use the bathroom often enough, and they take laxatives to try to solve this problem. Laxatives can help with bowel movements, but regular use of certain laxatives allows the body to get used to their action. This may cause a person to continue taking laxatives when they no longer need them. The person may also need higher doses to get the same effect. In other words, laxatives can be habit-forming, especially stimulant laxatives. This means that the more a person depends on laxatives, the greater their risk of constipation when they stop using them. Overuse of laxatives can also lead to dehydration, an electrolyte imbalance, internal organ damage. Some of these complications can become life-threatening. For this reason, people should talk to a healthcare professional before they start using laxatives. Not using the bathroom when necessary. If a person ignores the urge to have a bowel movement, the urge may gradually go away until they no longer feel the need to go. However, the longer they delay, the drier and harder the stool will become. This will increase the risk of fecal impaction. Not drinking enough water. Regularly drinking enough water can help reduce the risk of constipation. Other suitable fluids include naturally sweetened fruit or vegetable juices and clear soups. It is important to note that some liquids can increase the risk of dehydration and make constipation worse for some people. For example, those who are prone to constipation should limit their intake of caffeinated sodas, coffee, and alcohol. Colorectal problems. Some health conditions that affect the colon can impede and restrict the passage of stool, leading to constipation. Examples of such conditions include cancerous tumors, a hernia, scar tissue, diverticulitis, colorectal stricture, which is an abnormal narrowing of the colon or rectum, inflammatory bowel disease (IBD). Other conditions. Some other medical conditions can also cause or contribute to constipation. These include neurological conditions, multiple sclerosis, Parkinson's disease, stroke, spinal cord injuries, and chronic intestinal pseudo-obstruction can lead to constipation. Conditions that involve hormonal function, electrolytes, or renal function, these include uremia, diabetes, hypercalcemia, and hypothyroidism. Intestinal blockage, this can occur if a tumor blocks or squeezes part of the digestive system. Conditions that affect the digestive system, constipation can occur with celiac disease, IBD, and other inflammatory conditions. Cancer treatment, chemotherapy and opioid pain relief medications can also trigger constipation. Treatment. Constipation usually resolves itself without the need for prescription treatment. In most cases, making lifestyle changes, such as getting more exercise, eating more fiber, and drinking more water, can help. Allowing time for defecation, without stress or interruption, may also help. People should also not ignore the urge to have a bowel movement. Laxatives can improve symptoms in the short term, but people should use them with care and only when necessary. This is because some laxatives can have severe adverse effects. The Food and Drug Administration (FDA) urge people to check with their doctor before using them, and to follow the instructions on the label with care. If constipation persists, people should see a doctor. They may need stronger medication. The doctor may also test for any underlying conditions. Keeping a record of bowel movements, stool characteristics, and dietary and other factors may help find a suitable treatment. Laxatives. Some laxatives are available over the counter, while others are available with a prescription. People should only consider using laxatives if making lifestyle changes has not helped. It is best to check with a doctor before use. The following are some laxatives and stool softeners that may help ease constipation. Fiber supplements, also known as bulk-forming laxatives, these may be the safest option. Fibercon is one example. People should take these with plenty of water. Bulk-forming laxatives are available from pharmacies and to purchase online. Stimulants, these cause the muscles in the intestines to contract rhythmically. Cinocot is one example. Lubricants, these help the stool move smoothly through the colon. One example is mineral oil, Fleet. Stool softeners, these moisten the stool. Examples include Collis and Surfic. Osmotics, these draw water into the colon to hydrate the stool and ease movement. Saline laxatives are a type of osmotic. Neuromuscular agents, these include opioid antagonists and 5-HT4 agonists. They work at specific receptors to regulate movement through the gut. How do stool softeners compare with other laxatives? Find out here. Other treatment options. If laxatives do not work, a doctor may need to remove impacted stool manually or surgically. If constipation does not respond to treatment or if there are other symptoms, a doctor may suggest an abdominal imaging study, such as a CT scan, MRI scan, or X-ray, to see if there is a blockage due to an underlying disease process in the gut. If there is, a person may need specific prescription medications or surgery to resolve it. Depending on the results of the tests and the person's response to medical or surgical therapy, they may also need further treatment. Find out more about the causes and treatments of hard stool here. Natural remedies. Some methods of easing constipation without using medication include increasing fiber intake. Adults should eat 25 to 31 grams of fiber every day. Fresh fruits and vegetables, as well as fortified cereals, have a high fiber content. Adding fiber-containing bulking agents to meals can help soften stools and make them easier to pass. One option is to sprinkle a tablespoon of wheat bran onto breakfast cereals or add it to a yogurt or smoothie. Drinking water. Water can help rehydrate the body and prevent constipation. Getting regular exercise. This can help make bodily processes more regular, including the passing of stools. Establishing a routine. Have a usual place and time of day to visit the bathroom without forcing a stool. Avoiding holding in stools. Responding to the body's urges to pass stools can help prevent constipation. Elevating the feet. Some people find it easier to pass stools during a bowel movement if they place their feet on a low platform, such as a step, with their knees above hip level. Herb mugwort. One 2015 study concluded that acupuncture and herbal remedies may help, but that more evidence is needed to confirm the usefulness of these methods. That being said, the use of herbal remedies is complex, and people should always speak to a doctor before trying anything new, as they can have adverse effects. Anyone who has concerns about constipation should speak to their doctor. When to see a doctor. People should seek medical attention for constipation if the following symptoms also develop. Severe discomfort or worsening symptoms. Constipation that starts suddenly without a clear reason. Ongoing constipation that has not responded to lifestyle changes. Blood in the stool or bleeding from the rectum. Constant pain in the abdomen or lower back. Difficulty passing gas. A fever. Vomiting. Unexpected weight loss.